Hello and welcome to InfoWide. Here's another video that would help us to be aware regarding this virus called monkeypox. A recent outbreak of monkeypox cases is being investigated by health authorities in Europe, the United States, and Australia. Monkeypox is an uncommon viral disease that is generally restricted to Africa. Germany confirmed its first case of the virus on May 7, 2022, joining the United Kingdom, Spain, Portugal, France, Italy, and Sweden as the latest European countries to announce an outbreak. As experts try to figure out what's behind the sudden rise, the United States and Australia verified their first cases that week. While some cases have been connected to travel from Africa, more recent illnesses are believed to have spread throughout the community, increasing the likelihood of a larger outbreak. The Centers for Disease Control and Prevention in the United States, and the Health Security Agency in the United Kingdom, said they are looking into a number of cases, including those involving men who have sex with men, and urged gay and bisexual men, in particular, to be aware of any unusual rashes or lesions. Since the first case was discovered on May 7, 2022, the number of cases in the United Kingdom has doubled. There are currently 20 documented instances of monkeypox in the country, with fears that there may be many more undiscovered. Individuals who are experiencing signs of the virus, such as rashes and fever, should seek medical attention immediately, contacting any clinic before going. These recent cases, together with reports of infections in nations throughout Europe, underlines early fears about monkeypox spreading inside communities. What is monkeypox? Monkeypox is a rare disease caused by the monkeypox virus, which is related to smallpox, but is usually less severe. The virus, which is mostly found in remote parts of Central and West Africa, was first discovered in captive monkeys in 1958. In 1970, the first human case was documented. Since then, sporadic cases have been reported in 10 African countries, including Nigeria, which had the largest documented outbreak in 2017, with 172 suspected and 61 confirmed cases. 3/4 were males, between the ages of 21 and 40. Cases outside of Africa have historically been rare, and are usually associated with international travel or imported animals. Previous cases have been reported in Israel, the United Kingdom, Singapore, and the United States, which reported 81 cases in 2003, linked to prairie dogs infected by imported animals. How do you catch monkeypox? Monkeypox spreads when one person comes into close contact with another infected person, animal, or material. The virus can enter the body through open wounds, the respiratory tract, or the eyes, nose, and mouth. Human-to-human transmission is most commonly transmitted via respiratory droplets, but requires prolonged face-to-face contact. Meanwhile, animal-to-human transmission can occur through a bite or scratch. Monkeypox is not considered a sexually transmitted disease, but it can be transmitted during sex. What are the symptoms? Monkeypox symptoms include fever, headaches, muscle aches, swelling, and back pain. A rash appears 1 to 3 days after the appearance of fever, often starting on the face and spreading to other parts of the body, such as the palms of the hands and soles of the feet. The rash, which can be extremely itchy, then progresses through several stages before the lesions scab and fall off. The infection usually lasts 2 to 4 weeks and goes away on its own. What is the treatment? There are currently no proven, safe treatments for monkeypox, despite the fact that a majority of cases are mild. People suspected of being infected with the virus may be isolated in a negative pressure room, a space used to isolate patients, and monitored by healthcare professionals, wearing personal protective equipment. Smallpox vaccines, on the other hand, have proven to be largely effective in preventing the virus's spread. Countries such as the United Kingdom and Spain are now providing the vaccine to those who have been exposed to infections, in order to help reduce symptoms and limit spread. How dangerous is it? Monkeypox cases can be more severe at times, with some deaths reported in West Africa. However, health officials emphasize that we are not on the verge of a major outbreak, and the risks to the general public remain very low. While investigations into the source of the infection continue, it is important to note that it does not spread easily between people, and requires close personal contact with an infected symptomatic person. Health authorities in the United Kingdom, the United States, and Canada, who notice new rashes, or are concerned about monkeypox, should contact their doctor. It is also stated that it is reaching out and providing advice to any potential close contacts of cases as well as healthcare workers who may have come into contact with infected patients. It's the end of the video. Thank you for watching, and please don't forget to like and subscribe.